Hi, Dr. Matteo. I wanted to ask you a couple of questions about the cold and flu season that's coming up. There seems to be a lot of stuff in the news about vaccinations, and a lot of people are really scared about getting the flu. What are your thoughts on it?
This time of year, we start to see, the worry, cold and flu season, get yourself ready, and the number one thing you hear is what? Go get your
Flu shot.
Exactly, and I don't know why, but for some reason we're seeing a really big push, huge banners outside of CVS and Walgreens. I was at the airport a couple weeks ago, and I kid you not, at the gate there was a flu shot booth set up so that you could get inoculated before you got on the plane. And there's so many other ways. Whether you believe the flu shot works, whether or not, personally, I don't get one. I advise people not to get them. I've done the research. There's side effects.
But a lot of people are really scared. I mean, I've seen reports where 30,000 people a year die from the flu. That's a pretty disheartening thing.
So, the old saying, don't believe everything you hear. Here's the deal with that. What they do is when they talk about flu death statistics are actually lumped together with pneumonia. And so out of those two, which one do you think kills more people?
Pneumonia.
Yes, and so that's where we're statistically misled in that case. And so if they say there's X amount of flu deaths, the majority of those deaths are pneumonia, and these are straight from the CDC and their statistics. So
really, not that many people die from the flu.
Not that many people die from the flu. We're fooled into thinking it's this greater issue than it really is. And so the thing about your question is, what can we do this time of year and it's all about bolstering our immune system. And so a strong immune system will fight off disease more efficiently than a weaker immune system.
That makes sense.
So basically it comes down to two things. What are the things that strengthen the immune system? What are the things that weaken the immune system? And so we can start with weakening the immune system. Number one thing in modern society that weakens the immune system is stress. Stress changes your hormonal balance. Stress hormones cause a suppression of the immune system. And so obviously managing your stress, which is, albeit sometimes harder to do than others. Another thing that weakens the immune system, sugars, and more specifically, refined sugars. And so when you eat those simple sugars, sodas, simple carbohydrates, candy, and so forth, it actually suppresses the immune response. And so you want to avoid that. Things that promote the immune system, the foods that you eat. And so just like sugary and refined carbohydrates will lessen the immune system, well, things like fruits and vegetables, because of the phytonutrients and antioxidants, will actually strengthen that immune system. And so one of the most important things that you can do nutritionally at this time of year especially is to supplement with vitamin D. And so vitamin D is known as the sunshine vitamin. When sunshine hits our skin, it catalyzes a reaction that creates vitamin D. And vitamin D is a very, very powerful immune modulator. And so it's theorized that the reason this time of year is the flu season is, if you think about it, what happens this time of year with regards to the amount of sunlight?
A lot less.
It's
Daylight savings time and all that, yeah.
We roll our clocks back. It's cold. We stay bundled up. And so we're no longer getting that natural vitamin D. So our numbers drop dramatically.
I've heard that the majority of the American population has low vitamin D levels. Is that?
Yes, the North American population. And interestingly enough, our flu season is the exact opposite flu season as the Southern Hemisphere. And guess what? Our winters are the exact opposite.
Makes sense.
It makes sense. So the best thing you can do with regards to vitamin D is supplement it this time of year, because let's face it, it's going to be cold, rainy. You're not going to be out in the sun getting the natural form. So
there's different types of vitamin D, right?
Yes. So you want vitamin D3. Here in the office, we recommend the spray variety. Oftentimes when you swallow a pill, it goes down to the stomach, starts to get destroyed, it goes through the liver metabolism, so you're not really assimilating a lot of that nutrient into the body, whereas when you spray it into the mouth, it goes right into the circulation and will help build those vitamin D levels. And then the last thing that we can do...
And how much should we be taking?
An average dose is usually 5,000 IUs, but also average is going to be different for other people. One of the things that helps to know is what are your levels. So oftentimes it's important to get tested to make sure that your levels are being maintained within the normal range.
And so your medical doctor can do that?
Your medical doctor can do that. We actually have a blood spot test here that we can do in the office. And then what you can do is 3-4 months down the road, after you start supplementing, test it again to make sure your numbers are coming in.
And the number should be what? And is there a range that was healthy and
Depends
normal?
on who you read, anywhere between 60 and 100. So we tell our patients here you want to be around 70 to 80 would be a good dose. And so, and then the last and most important thing here is when we're talking about keeping the immune system strong, is to get your spine checked. A lot of people don't realize that the immune system is controlled by your nerve system, which also controls all of your other bodily systems, whether it be your cardiovascular system, your digestive system, your endocrine system. If your nerve system doesn't work properly, your immune system won't work properly. And so when we check a patient's spine and we look for misalignments in their spine that are putting disturbance on their nerve system, and we correct that, well, then the immune system will function better, and therefore they're going to be more resistant to disease. And it's quite common that we hear here in our practice that after people start getting adjusted regularly, they tell us, I don't get colds as much anymore, I don't get colds at all, I didn't get the flu this year, and so forth. So it's not any one thing, it's a combination of all of these things, but if you do those things, you're going to be that much less susceptible to getting the flu.
Yeah, so what I'm hearing from you is that washing your hands, things like that are important, avoiding people that have the flu. But if your body and your resistance is strong, it doesn't matter. You become disease resistant instead of disease promoting in your body.
We can't avoid germs. You ever wonder, you're on the bus, somebody sneezes, and you look at the immediate people around them, you can have 4 different people. Each one has 4 different reactions, right? One, nothing happens to. One might get a stuffy nose for a day. One may get a cold for a week, and one may become deathly ill. Well, what's the rationale for those differences?
They're all exposed to the same pathogen,
They're all
is what you're
exposed to the
saying.
exact same thing, but they all had a different resistance and adaptation to whatever that pathogen was. And so what we can't do is make the environment suitable to our body. We have to make our body suitable to the environment.
That's a really brilliant statement. Thank you very much. Appreciate it.